I'm Mark Spahn for the New York State Association of Chiefs of Police. Today we're speaking with Mike and Barbara Biasotti. They've been fighting for mental health reforms for more than 20 years. Barbara worked for 5 years as a registered nurse and almost 35 years as a school psychologist in New York State, caring for kids from 2.5 to 21. Mike is a recently retired police chief and president of the Committee on Untreated Severe Mental Illness for the New York State Association of Chiefs of Police. We discussed the mental health system, what it used to be, where we are now, and how our nation's law enforcement officers have become the go-to people when those with mental illness and their families are in crisis.
Is that we have two mental health systems in the United States today. One that exists and is well funded and has plenty of programs to help mentally ill people who seek and want to help get the help. And those that are too ill to get the help or refuse help become criminal justice issues. And it just seems that the mental health community is really not concerned about that second group. They're letting the criminal justice system handle that with the jails.
No, families have no place else to turn to but the police, because things do get very much out of control. Either the families are victimized or the individual is suicidal or whatever. They're picking up the phone and calling 911, please help me, because the medical people have not been able to respond. A lot of times they've been brought to the emergency room and turned away, or not admitted and not given the care that they needed or the aftercare. It's really falling on the hands of the law enforcement, and it's very problematic.
Such a small number of beds that when the police officer runs into somebody on the street who is severely mentally ill and brings them for evaluation, which, as you would guess, you have to be pretty ill to be the officer take you to the hospital for evaluation. The doctors, unfortunately, have to make a triage decision. We have 10 beds. They're all full. There's 5 people in the waiting room who are in psychotic episode. Do we figure out which 5 we can let go that are least likely to end up in tomorrow's headline in tomorrow's newspaper, so we can make room for 5 more? And that's the problem. And they end up, many of the officers, and I've seen it myself, the person being brought in for evaluation is back on the same street corner that you picked them up off of before you're back from the hospital. I mean, they're out the door as quick as you are because there is no space for them to be treated. And you know, many states have the 72-hour where if they are admitted, they're looked at for 72 hours. 72 hours is not enough time if the person needs medication to be medicated. I mean, or a medication that will make them not psychotic at the time. They require blood levels which take a week or more, 2 weeks, to get to a blood level where the person is returned to rational thinking.
Oh, it's very serious. You know, people are literally dying because there aren't enough beds. They're not being able to be admitted. They're in emergency rooms. Sometimes they're staying there for 3, 4, 5 days, and then they might get past the point of being dangerous to themselves, so a lot of places will release them, but there's still a huge need for them to receive treatment, and they don't receive it. So the shortage of beds is really problematic.
Is they go back because there's no bed space. They're on the same street corner. The officer goes back again. They're doing this, creating the same disturbance that they were. A store owner calls that they're back again. You just took them an hour ago. They're back again, and they're whatever, damaging things in my store. The next option, you're not going back to jail for the hospital or emergency room for evaluation. You've done that, and they said the person's not sick enough. So now it's the jail route, and now the person ends up in jail. And you know that they're not competent to stand trial. You know that the outcome is going to be that they're too ill. But now we have the jail involved, and they become the most hard to manage prisoners in the jail. They cause such a problem with the jail. They tie up our court systems. They tie, legal aid is involved, the judge is involved, the courts, the district attorney, all because they're not treated effectively, and we don't have the bed space to see that they're treated effectively.
In many areas, law enforcement can bring a person in for emergency treatment when they pose an immediate danger to themselves or someone else. In New York State, the law for an emergency admission says that police can take an apparently mentally ill person into custody who's conducting himself or herself in a manner which is likely to result in serious harm to the person or others. But many people suffering from serious mental illness need intervention before they become a threat to themselves or others.
And that standard is a problem. The standard should not be dangerousness. The standard should be an obvious need for care. And I would argue today that most police officers deal with and see more severely untreated mentally ill people than does the psychiatrist in your community on a regular basis.
I think it's unreasonable. I think that a lot of people need care very badly before they reach that threshold of being dangerous to self or others. I mean, it's the only diagnosis that I know of that requires a dangerousness in order to get help. It doesn't make sense. You can see the trajectory of the symptoms and of the problem, and not doing anything about it as it's quickly approaching a suicidal or even a homicidal state. Why do you have to wait till it reaches that actual point? It just doesn't make sense.
You know, they're a tough patient. They're a tough patient for a psychiatrist. There's a shortage of psychiatrists. As a psychiatrist, do you want to see the man or woman going through a divorce who can't sleep at night that you give a prescription of Valium to and say you'll get through this? Or do you want to see the person that threatened to go to the elementary school and shoot the place up? Obviously, you'd rather deal with the person going through the divorce. So it's a tough, it's a very, very complex problem and issue.
Psychiatric disorders are now considered brain diseases, no different from kidney disease or heart disease. And to think that somebody with that type of problem, either kidney or heart or liver disease, would go to a jail to get treatment is completely illogical. So we're really trying to turn this around and take the responsibility for psychiatric care, give it back to the medical professions and social services professions that really should be the ones to do that.
How did we get here? How did we go from the antiquated methods of locking up people with mental disorders in jails and prisons, to placing them in asylums, to letting them go without any care? Chief Biasotti explains.
And what happened, it started way back, you know, in the days of Dorothea Dix, who was a teacher who went into the jails in the Massachusetts area and saw, her goal was to teach inmates how to read. She thought that would help them avoid, a life of crime. And what happened was she realized most of the persons in the jails were mentally ill. So she started a movement that spread nationally because it was inhumane to have mentally ill people in jails, to create a system of asylums throughout the country to house mentally ill people to be treated rather than jailed as prisoners. And so most of the states adopted that path and created these facilities. And what happened was in about 1962, they started looking at, the federal government started looking at funding or assisting states with helping persons with illnesses, and the whole Medicaid system started 62, 65, somewhere around in there.
Funding.
And so what happened was, as they increased the funding, they said, listen, you have all these, we're going to do that for ill people that are in the hospital, no matter what the illness, whether it's your kidney or your heart, or we're going to subsidize that. However, you have all these wonderful asylums working where the state is already taking care of mentally ill people, and we're going to exclude them from that. And that's what's called the Institute of Mental Disease Exclusion, or IMDs, which is a big problem now in that what happened is the state said, now wait a minute, we will not get reimbursed for people that are in institutions of mental disease. So that whole bill stayed on the state, while the rest of the bills for other injuries or other serious illness was subsidized by the federal government. Well, that created a huge benefit or an incentive for states to deinstitutionalize if we move them out of the state hospitals. And the plan at the time, which I think was a good plan, because at the same time the first drugs were becoming available that actually helped mental illness, improved the condition of the mentally ill person. So the thought was they would build community treatment facilities, take persons out of the asylums, close the asylums. Once they removed the asylums, they were now in the public, and the federal government money would kick in towards offsetting the costs, and they would treat them in residential community facilities. Not necessarily residential, but community facilities. What they forgot to take into account was that many of these people will not seek treatment on their own. So they didn't go, and many of these facilities weren't built. There were no treatment facilities in the communities built. So that immediately fueled the homeless population, and you started to see an increase of homelessness and mentally ill people living on the streets. And deinstitutionalization is still happening today, because they're slowly, it's almost triaging it, in that, of course, if you're going to release somebody, you're going to release the person you think least likely to be a problem. So the further you go along this road now, the hospitals are getting less and less full, less and less beds, so they're starting to release more and more persons who truly need hospitalization to be stabilized.
A study by the Treatment Advocacy Center indicated there were almost 560,000 public psychiatric beds available throughout the U.S. in 1955. In 2005, there were about 50,000. That's more than 90% fewer than in the 50s. So where are these people getting care?
I'm not saying that people belong in hospitals. What I'm saying is the bed space needs to exist so that the person can be properly stabilized before they're returned to the community. And this is where I think you're seeing the criminalization of mental illness come in, because these persons are now displaced from the hospital that was caring for them. They do not seek treatment on their own when they're in the public, many of them, and they end up committing small crimes. They're not serious enough ill by our current laws that they would be hospitalized till treated until they become dangerous. So they become stuck in this revolving door of the criminal justice system. And as we were mentioning before, the numbers are, I think 350,000 now are in prison with severe mental illness, while there are 35,000 in hospital beds. So it is 10 times the number of persons with severe mental illness who are in prisons compared to those in hospital beds in this country.
Mike and Barbara have been advocates for persons with mental illness and for the families trying to navigate a system and bureaucracy that almost seems as if it was built to fail. Their story is remarkable, and it highlights their concern and compassion for others. Their story tells us how it has shaped their advocacy.
We met because my daughter had become mentally ill. She was ultimately diagnosed with schizophrenia, and she wasn't receiving care because she has a symptom of schizophrenia called anosognosia, which is simply a word that means without awareness, and it's about half the people with schizophrenia experience this symptom, and they cannot see themselves as needing care because they don't see themselves as mentally ill. Stroke victims also experience anosognosia, and they'll often think that they can walk when they can't. They cannot recognize the fact that half their body is now unable to function the way it used to. So my daughter was she was being victimized, and I did turn to the police for some assistance, and I happened to be introduced to Mike by a good friend of mine who was working as the town attorney there, and he was very helpful, and many families turned to the police for help. We just happened to fall in love afterwards.
I think it's why we became advocates. We were when I met Barbara and we had these problems, and I'm like, this shouldn't be a problem. I know everybody in the county. I know everybody in the county mental health department. Barbara knows psychologists, psychiatrists. This should be a piece of cake. Well, that was 20 years ago, and we still struggle with it daily, getting help and maintaining help. And I feel for these families that it doesn't matter. I know billionaires who are going through the same thing, and no matter how much money they have, you can't correct that problem. You can't help your loved one. And it almost seems in some instances that the system works against you. In many of these mass shootings, you'll see without a doubt, the shooter was severely mentally ill. Many times you'll see that the family said, we tried to get help. We turned everywhere. We did everything we could. And often it's the police are the only ones that offer any kind of help. And that's why the police are called. Nobody else will help. And I think I'm very motivated about it because of that. There's never been an incident that I really felt helpless about, except this. You know, I mean, there really is not any, I've always been able to, well, we'll figure this out, we'll conquer this. It's, it's a tough one.
Well, one of the things we realized was that this was really difficult for us, and that we are more equipped because of our professions to deal with it, and we struggled, and we felt that we needed to help other people, help their family members who are, or their loved ones who are mentally ill, and you know, just advocating, you know, whether it's writing letters or going to groups, or how to insist that they get care was something that we really have tried to teach people to do.
You can learn more about social issues and mental illness by visiting the Treatment Advocacy Center website at treatmentadvocacycenter.org and the Mental Illness Policy Organization at mentalillnesspolicy.org. I'm Mark Spawn for the New York State Association of Chiefs of Police.